I'm David Griffiths. I've been a GP in Oxford for 7 years and I'm passionate about improving our systems. I'd like to talk to you about some of the challenges facing general practice in 2015. If you have read any newspaper in the first few months of 2015, you'll be aware that GPs are facing huge challenges. The UK population is becoming older and frailer, and many more people are living with long-term medical and mental health conditions. New and innovative medical treatments are increasingly available, and healthcare is becoming more complex and more expensive. As a result of this, the needs of patients are growing and changing rapidly. Patients' expectations have also changed. They are asking for access to care at non-traditional times, using non-traditional communication methods that we're not currently set up for. Patients also want support from healthcare professionals for complaints that in the past may have been ignored or managed in other ways. So the everyday pressures of the job are significant, and there is a strong sense that they are increasing. Working in the same way that we always have is becoming unsustainable, yet many of us are fatigued by years of shifting incentives and directives, as well as the NHS's ever-changing structures and approaches. Understanding that different patients require different options is easy. Changing the system to deliver a flexible service without losing the benefits of the current model, the continuity and relationships that many patients value above all, is the real and very challenging goal. I often think that there is a promised land, where less but more enjoyable work gives better outcomes for patients and staff. The trouble is that Nirvana is on the other side of an imposing mountain. There's a lot of work to be done to climb it, and with the pressures I've mentioned, it can seem pretty much impossible even to try. It is not surprising, therefore, that there has been such an enthusiastic take-up of the Prime Minister's challenge funding to improve access to general practice. However, the award of PMCF funding and recognition of a well-planned project comes with significant pressures, not least the complexity of the challenge and the short timescales. Funding also comes with accountability, of course. Local project teams could be forgiven for feeling somewhat daunted. The good news is that successful applicants are supported by the NHS IQ team, fresh from backing the PMCF Wave 1 sites, as well as a hugely positive large-scale change programme delivered to over half of CCGs in England. The team includes active clinicians like me and experienced commissioners, as well as colleagues from social care and local government backgrounds. Our support takes a variety of formats, including workshops run by our experienced facilitation teams, and a range of effective tools and techniques to support PMCF sites in creating the best possible outcomes with their programmes. You can access further information and a variety of materials using these links. Thank you for listening.